Hi, welcome to LVI TV. I'm Mark Duncan, and I want to bring you another episode of What Were They Thinking? Today we're going to share a couple of weird stories. I don't know if it's glamorized in the movies or if it truly is just that cool to be a dentist. Wait a second, it really is that cool, isn't it? Anyway, there are some people doing some odd things, and it's shocking that knowing what they know and seeing all that can go wrong, and of course knowing the power of dentistry to do good within the confines of our license, it's just weird what some people choose to do. There was a sweet 45-year-old practice manager in a practice in the Bronx who would stay in the office while the doc was gone to get things done. Apparently, one of the things she decided to get done was to try on the white coat. And as we all know, all it takes to be a dentist is to have the right coat. Anyway, once a week, Valbana, wearing the jacket, she became Dr. Val. This jacket gave her the ability to diagnose patients and to take x-rays and to anesthetize patients and even place root canal fillings. And she ran her own schedule, and as an astute businesswoman, she offered discounts for patients who would pay in cash. Her reign of healing lasted almost a year, from November 2012 to August 2013, but it seems patients were frustrated by the marginal quality. Just goes to show that you really could use some exceptional clinical skills. I don't know, perhaps you're aware of a world-class postdoctoral training institute. Now, when her boss, the doctor, started getting complaints about the poor quality of the work done in his office, but it wasn't done by him, he grew suspicious. And once the cat was out of the bag, he actually fired her.
You're fired.
A little further south, an enterprising woman decided that rather than run the risk of getting caught by the boss and dentist, she would simply not have one. And in Orlando, a woman opened a clinic that had 2 chairs, x-rays, small dental lab. It was a clinic built into a home that operated literally for years. In the office was a licensed hygienist who had a clean record, but perhaps that's because she spent her time practicing dentistry. Now, both ladies had training in other countries, but neither was a dentist here in the United States. Meanwhile, a dentist in Germany who actually is a dentist also went off the reservation. The dentist claimed to be a recognized healer, whatever that is, treated a patient who happened to be schizophrenic, and together the two apparently came to the conclusion that the patient's teeth were destroying his energy flows in his body, and they removed them. Oh, and also, the teeth were the source of erectile dysfunction. Too bad the dentist didn't recognize that the most likely connection between the mouth and ED is that sleep-disordered breathing, and he actually could help his patients and let him keep his teeth. Over the period of about 4 weeks, Alex, the patient, had 19 teeth removed, and while the dentist claimed that he suffered from inflammation and was allergic to fillings, the reports after the incident showed that the inflammation was from the extractions. But I suppose if you spend 4 weeks removing teeth, that might happen. At any rate, there still seems to be a bit of disagreement, as the dentist was fined 20,000 euros for being a knucklehead, and the dentist still claims the patient owes him 50,000 euros for his healing services. It's a weird world out there, with office managers and hygienists wanting to be dentists and dentists wanting to make things up, but the reality is we really do hold the keys to many things if only we stop limiting our focus on the teeth and pay attention to the rest of the body's physiology. If you want to be a dentist, go to dental school. If you want to be an exceptional dentist, get exceptional training after you graduate. And above all, focus on being the part of positive change for your patients. It's impressive that they trust us like they do. Get yourself as educated as you can and make sure that everything you do is exceptional. That's the key to being happy anyway, so why not? Thanks for tuning in to LVI TV. I'll see you next time. I'm Mark Duncan.
You're definitely learning something new, a little bit more every time you come out here, but it's always being
with healing, nourishing, and regeneration of the body. Its nerves stimulate the immune system.
With what my medical doctor thought was chronic sinusitis.